future. So I'm going to shortly talk about what is going to happen next. Again, we're taking it off the face to try to do different application. First of all, we try to combine it in the submental area to melt fat as well, with the addition of the body cartridge. And we are looking for two main applications in other body areas. One of them is the cellulite, and for that purpose we are now running a very large multi-center study in the US to get approval for cellulite. We have already patients going and they completed treatment. I will show you some of the preliminary results from that study. And we also have some early preliminary results for hyperhidrosis, which definitely is going to be our next priority to get FDA approval and pursue this indication as well. So let's talk about the 75, the new cartridge. Again, we have a new handpiece and a new cartridge. The needle penetration angle now is going to be 75 degrees, and that to allow you to go deeper. Okay? Now, other than that, there is no change in the needle characteristics. Okay? Everything other, the size, the length, everything else is the same, except for the numbers. We increase the numbers to allow a better coverage in a shorter time duration. Okay? So everything else is basically the same. The applicator is different because we took out the cooling plate to allow the penetration. We also don't need the cooling plate because now we go deeper and the thermal diffusion doesn't get into, we don't get any increased temperature into that can affect the epidermis. So these are the changes. This is how it looks like, the new applicator, the new cartridge. This just shows you the difference between the two cartridges. And again, both of them are going to be applicable on the same system, and the system you currently have is going to have a software upgrade and will be able to operate with the two applicators and the different cartridges. So let's talk about cellulite. Actually, the first idea to treat cellulite came a few years ago when Dr. David Goldberg actually presented that at ASLMS in the USA. And what he did, he took some of his patients and he treated them one side with Profound and the other side wasn't treated. So what you can see here, that the left side, this side, was treated with Profound, and the right side wasn't treated. And you can see here nice improvement and lifting in the left side. Then he tried to compare it to Altera. So he was using the Altera to do robotic lifting. The problem was it was too painful for the patient. The procedure was too long and too expensive because the cartridges were very expensive. Because he was part of the original E-prime study that was part of the FDA, he wanted to try the Profound. So he took a patient. This patient was treated a year before that with the Altera. And now this is the baseline, okay? So this baseline is after the treatment with Altera. Now the patient came a year later and he applied a Profound treatment to the left bottom side. And you can see the change from this photo to this photo, making almost, I think, if not better, the same lifting as of Altera, but with the added benefit that this treatment, when you take it off the face, it has minimal pain associated with it. It's much faster and less expensive. So this treatment was done with the regular cartridges even. So when he presented that, this brought us to think, how can we modify the cartridge and the applicator to make it more applicable to treat cellulite. This is how the body cartridges was designed, and this was a patient done with the body cartridges by Nita Bowie, and you can see here very nice improvement in this area for treating cellulite. So we follow this up with doing, this just show you, we are doing now, as I said, a multi-center clinical study, 4 sites in the USA, 44 patients, all of them completed treatment. We are now doing follow-up up to 1 year after the treatment. We are doing cellulite grading based on the known Muller-Nuremberg scale that has different grades, going from 0 to 7. As you can see here, I don't want you to go into detail. This is more for the study itself. We also count the number of dimples in the area that we treat and the numbers of contour irregularities, and we combine the 3 different scales to show the improvement. This is the requirement by the FDA. All of this has to be evaluated by a blinded evaluator. So again, this is the sites that are running currently the study. This shows you that most of our patients has moderate grade of cellulite with 2 to 4 dimples and moderate degree of linear of contour irregularities. And again, using this type, we use the same type of anesthesia as for the face. The only difference is, you know, it depends on the size we treat. We may go higher with the volume, as well as we need to go a little bit deeper with the injections of the lighter, just because the target area that we treat now is deeper than the deep dermis. And what you can see here is preliminary result, shows you the improvement at 1 month showing in red, as well as 3 months showing in orange for both the number of dimples as well as the degree of contour irregularities in these patients. So definitely there is nice improvement over time. I hope you can see the improvement in these photos, going from baseline to 3 months follow-up. Another patient with very nice improvement in this area. The area that is marked here is basically the area that was treated. So we limited the size of the area to be very much controlled between patients. This is a patient with severe, very severe cellulite, but again, you can appreciate the improvement from baseline to 3-month follow-up. And again, another patient from Dr. Goldberg. So the finding from this study, it's a safe procedure, it seems to be effective, we do see improvement over time, definitely. We get some improvement at 1 month and it's increasing over time. We are still waiting for 6 months follow-up, and then we're going to submit it to FDA. So to summarize, the real-time temperature, feedback and control of the energy delivery and the target tissue temperature enable us to get reliable, consistent and predictable results. We now have the gold standard protocol. Treatment parameters are optimal to get the best effect we want to get, the best collagen remodeling with minimal tissue hypoxia. We get significant improvement in skin laxity, texture, elasticity, volume, and we do see progressive results over time, so you need to emphasize this to the patient. You don't see immediately the result, you need to wait. Some of them are even have to wait longer. And we are going to take it to future applications such as hyperhidrosis and combination treatment of the 2 cartridges together. Thank you.